Hello, our project is on the intervention for the national crisis that is the opioid epidemic. In this project, you will be hearing from myself, Alexis, Eddie, Ashley, Mackenzie, and Abigail. Alright, so just for a little bit of background on the opioid epidemic, there are almost 47,000 overdose deaths from opioids in 2018. The disparities among prescription rates are very evident, especially in rural and poor communities. The war on drugs was originally created as an intimidation factor for people of color, although the opioid epidemic is now affecting people of all socioeconomic levels. And the opioid overdose epidemic was declared a national emergency in 2017. We decided to call this our rationale for addressing the opioid epidemic, and we're going to be talking about things like intervention strategies such as legalizing marijuana to help curb the amount of opioids that are prescribed to people and therefore available for people to misuse and become addicted to. And here we just have our citation page that we use throughout the presentation, and you can find in-text citations somewhere on the screen in each slide.
Epidemiology of the opioid epidemic. There are 4 types of opioids: natural, methadone, heroin, and synthetic origin. Of those variations, synthetic opioids cause the most fatalities each year. There have been 3 waves of the opioid epidemic. The increase of prescription opioids. This occurred in the 1990s. The increase of heroin usage deaths, occurring in 2010, and the increase of synthetic opioids starting in 2013. Most deaths involving opioids also involve other drugs, which can make it hard to determine the death cause. With many drugs falling under the same branch, it is important when examining opioid-related deaths that statistics and the type of drug is taken into account. According to the most recent data, in 2018 there were 67,367 drug overdose deaths, of which 46,802 were accounted for by opioids. Looking at the chart on the right, it is clearly shown that there are 3 waves and that nearly 450,000 people have died overall of opioid overdose between 1999 and 2018.
Biostatistics in the scheme of the opioid crisis uses research methods to gather quantitative data to gauge the development of the crisis in the U.S. and has been consistent with methodology since the crisis began. Data methods such as cohort studies, case control studies, and cross-sectional studies are applied to determine the rate of usage, the consequences, and possible solutions to opioid abuse. Cohort studies are conducted to observe opioid abuse over time in exposed and non-exposed subjects and can be retrospective or prospective. Case control studies observe the amount of exposure to opioids in addicted patients and non-addicted patients. Cross-sectional studies examine abuse patterns from specific populations during a given amount of time. The data collected reveals trends of opioid usage and mortality rates in the U.S. An example of a study was a retrospective cohort study conducted to determine the association of opioid prescriptions from dental clinicians for U.S. adolescents and young adults with subsequent opioid use and abuse. The sample number consisted of 12 to 14,000 privately insured dental patients split into 2 groups of indexed dental opioid cohort and dental non-exposed cohort, and the ages ranged between 16 to 25. Independent variables included demographics like age, race, location, socioeconomic characteristics like income, and encounter data, pharmaceutical data, financial data, and laboratory results. According to the researchers, the data collected showed that exposure to opioids through a dental clinician in a population of opioid-naive patients was associated with higher rates of opioid use at 90 to 365 days later, and subsequent to diagnoses associated with opioid abuse or overdose compared with controls.
The social and behavioral sciences concentration in public health aims to identify, address, and eliminate disparities in society. In the case of the opioid crisis, many factors contributed to its devastating effects, and even today, lasting inequalities, cultural norms, and socioeconomic factors continue to adversely influence our society. One of the most jarring statistics remains to be the false understanding that many doctors have when prescribing opioids, which is that 40% of first and second year medical students endorse the belief that Black people's skin is thicker than white people's. The idea that Black people are less susceptible to pain is not only an inherently racist concept, but it leads to underdiagnosis. Doctors end up either not prescribing opioids to Black people or prescribing too little when needed, forcing them to unnecessarily and inhumanely tolerate the pain. In the United States, we struggle with prevention regardless of the fact that money is continually funneled into funding for prevention programs. Our cultural norms in the U.S. weigh heavily on our healthcare system and have influenced a generation into thinking quick fixes to health problems are better than solving the issues over time. The heavy use and emphasis on prescribing opioids are an indicator of this new norm. This temporary solution causes more harm than good by ingraining the idea that depending on painkillers for immediate relief is more acceptable than actually learning how to manage pain in a healthy way. A public health intervention program in Ohio is already setting an example as their prescribing and overdose deaths were reduced to half after the simple change of better educating surgeons on how pain medication should be prescribed after operations. When intervention fails and the dependence on opioids to relieve pain develops into an opioid addiction, many cannot afford to seek treatment. Socioeconomic related factors such as low education rates, reduced employment options, and high poverty estimates play a part in increased opioid use disorder and lack of attempts at addiction recovery.
Environmental health is a significant aspect of public health that must be considered when approaching various topics like the opioid crisis. Different environmental factors have contributed to this epidemic. For one, different types of working and living conditions can increase the risk of becoming dependent on opioids. Poorer communities who have less access to treatments and therapies can turn to opioids for pain management. According to a publication by the American Public Health Association, individuals who work in jobs that require heavy physical labor, stress, and those who have decreased health benefits are more likely to misuse opioids. Another impact the opioid crisis is bringing to the environment is freshwater contamination from chemicals from opioids found in urine and feces. This poses a harm to ecosystems and various species within the waters. There are various other side effects that have come out of the opioid crisis that significantly influence environmental health.
When it comes to health policy and management, one of the things that needs to be focused on is a search for a non-addictive drug that can treat chronic pain so that it can replace opioids and drastically decrease the amount of opioids that are being prescribed to patients. We would also like to focus on treatment centers for those that are already experiencing the addiction to opioids and to help them recover from this. We would lastly like to give out information for people that may be bystanders to things like an opioid overdose so that they know what to do. HEAL is an initiative that stands for Helping to End Addiction Long Term, and it is a program that aims to help those that are already dealing with the addiction to opioids. As I said, looking for non-addictive ways to manage this chronic pain, medical marijuana has been talked about because it would reduce the amount of people that are being prescribed opioids, therefore decreasing the addiction to opioids from extended use and possible misuse. Finally, we look at interventions across each level of the social ecological model. For the individual level, we talk about improving our personal knowledge about everything that we can learn about opioids. For the interpersonal, it's creating networks of family and friends who will look out for each other in regards to opioid usage. On the organizational level, there's education programs in schools and workplaces about the usage of opioids and addiction from opioids. On the community level, we have support group and resources for those that are worried about anybody regarding opioid usage and addiction. And on a public policy level, that is the proposition of legal medical marijuana as an alternative to these highly addictive opioids that are causing this high rate of addiction. And that is the end of our presentation. Thank you for your time.